Um, we are now going to show you Patient Focus Board, another tool that is very beneficial for the nurse in charge to use, as this is a high-level overview of your ward. So from the navigator bar, we are just going to select Patient Focus Board. This view can also be customized and columns can be made bigger to improve your view. So where you see this column here, the comments column, it's very small, so you just select beside it and drag it over. And then this customization will then stick. So you don't have to do this every time you go into your patient focus board. Another customization we can do is over at the right hand side, over on our burger menu, you can select layout configuration. And here you have a list of all the different columns that the patient focus board offers, and you can see that some of them are unticked, and this is because they are not currently in our view. If you wish to have dietitians back on, you just tick it, and then once you click apply, this column will then be visible. You can also move the order of the columns, so if you wish for allergies to be a bit higher up, you just select it and drag it to where you wish for it to be. And you can also customize the rows. So this is in your patient column here. At the moment, you can only see your patient's name and NHS number. However, we recommend to having 4 rows visible because this will then allow you to see the patient's MRN number and date of birth. So once we then select apply, you will then see these changes we have made pull through. So in our patients column, you've just got a much better view of your patient's details without having to go into their record. And we also have these blue lines either side of our patient focus board, and this is to then be able to see the additional columns. As you saw, we have got a lot. So if we start clicking, you can then see it just allows you to view these additional columns that are hidden. So this is why we also recommend you customizing your patient focus board. So the ones that you find that you're checking more frequently. So your EWS here, you can see your patient's most recent early warning score that's been taken. You've got your discharge overviews here. And yes, so customizing view allows you to quickly see any deteriorating patients, both during your huddles and also at a glance throughout your shift. So using the iPass and the clinical data within it allows you to see trends in the deterioration to be able to care for the patients.